In order to provide the safest treatment possible for your patients, any surgical drilling should be carried out with a handpiece with an external water supply. Any handpieces using an internal water supply, that water is air driven and that carries the potential risk of surgical emphysema. The water is also running through your chair system and so it cannot be sterile. Now, we all know that an external water supply is crucial once you've raised the flap, but a slightly more grey area is sectioning teeth. The general consensus is that it's probably okay using a speed increasing handpiece. Now, if like us probably doesn't fill you with confidence, then the way to go is an external water supply handpiece. So how do you achieve this in practice? You can use an implant motor with a connected saline supply, a surgical motor with a connected saline supply, or you can use this system which we've put together, which is a micromotor combined with a peristaltic pump. The beauty of this setup is that it's versatile and economical, giving you access to a micromotor for general restorative use. That in turn offers superior speed control of your handpieces, more constant torque. And this can be used as a standalone unit alongside internal water supply handpieces, one-to-one and speed increasing. Once connected to the peristaltic pump, you can then use external water supply handpieces for surgical applications. In this next segment, I'm going to show you how to connect the system to your chair. So both your peristaltic pump and your micromotor need to be connected to a main supply. Take your saline bag, attach your irrigation tubing, and then this feeds through the pump mechanism of the peristaltic pump, like this. And then you just need to attach your tubing from the chair. So now you're going to take a hose from your chair. This is an M6 and these units are compatible with both M6 and M4. And you're then going to attach this to the back of the peristaltic pump, being sure to screw this as tight as it goes. Next up, we take the hose from the back of the peristaltic pump and we're going to attach that to the micromotor, again screwing as tight as possible. Now you're going to take the motor from the micromotor and you can just pop that in your regular chair housing, and that's all going to be powered by the chair foot pedal. So now you're all set up, you can pick which handpiece is appropriate to the procedure. So you could use a speed increasing handpiece for sectioning teeth or a straight handpiece for bone removal, one-to-one. So in this case, I'm going to use the speed increasing. We've set the micromotor to 40,000 RPM. Now remember, your 1 to 5 is going to gear that up 5 times. So you're going to end up with 200,000 RPM, really good torque, perfect for sectioning teeth. You just want to connect the hose now to the end of the external water supply, like so. Attach that to your motor and you're good to go. And here we have it in action. Now to set up the micromotor as a standalone unit, you simply need to remove the chair tubing from the back, the peristaltic pump, remove the peristaltic pump tubing, and simply place the chair tubing into your micromotor. You can then use a regular speed increasing handpiece with internal water supply for your restorative work. Thanks for watching. If you have any questions, feel free to ask in the comments below.